Nursing students, listen up, because this chart is the reason why your nursing school exams are so difficult. No matter how hard you study, if you're still studying the way that you studied before nursing school, you are always going to struggle and possibly even fail when it comes to your nursing school exams, and here's why. This chart is known as Bloom's taxonomy. Hopefully your nursing instructor has mentioned this to you at least, if not fully explained it. But I find that a lot of nursing students have never even heard of this before, which is insane to me. So what Bloom's taxonomy is it's a way of categorizing the difficulty level of questions that you get in order to check and see how well you understand a topic. Now, prior to nursing school, almost all of your exams were done at this difficulty level, which is the lowest difficulty level. It's your straight up remembering and understanding. So these are going to be your types of questions like, what does the kidney do? Or what does the liver do? And what are the symptoms of disease XYZ? Very straightforward, and memorization can be a very excellent, straightforward study technique when it comes to questions that are written at this level of difficulty, because honestly, they're not very hard. You either know it or you don't. However, you're already listening and saying, yeah, that's not the nursing school questions, and you're absolutely right. Because the problem with the nursing school questions is that it's no longer you know it or you don't. You can study and study. You could literally memorize everything in your textbook chapter and still not be able to answer the test question, because it's not asking something that's a simple, did you memorize this from the textbook? That's because nursing school questions come from the application and analysis level of difficulty. This is the level that NCLEX questions are written, and so this is the level that your nursing instructors also try to write them at. In addition, if you take ATI or HESI, they're all also written at the application and analysis type level. Now, the way I explain what analysis and application type questions are is it's more like you are given some information in the question. You have to use your critical thinking and clinical judgment to identify what's the most important information in this question, pull it out, and then it has to trigger what you need to pull from your brain. Because yes, there is some information that you do have to remember and understand in nursing school, but that's not what you're being tested on. They just expect you to do that on your way to being able to do the analysis and application level of thinking. So you have to be able to pull that information out of your brain, then combine it with the information they give you in the question. And when you combine those things, then you should be able to apply the information to get the correct answer, or analyze the situation and the information to get the correct answer. And when you can successfully do that well enough to be comfortably passing, not getting straight A's, because I'm not worried about getting straight A's, your mental health matters more than that, but to be comfortably passing, then they know that you are successfully developing the most important skill that you're in nursing school to learn, which is how to think like a nurse, otherwise known as your clinical judgment. Now, there are two higher levels of questions, so you can be thankful you don't have that in nursing school, and that's the creation and the evaluation. I don't think we're ever going to see that in nursing school anytime soon, because when you get up to these levels, you can't assess those levels of difficulty with multiple choice questions anymore the way that you can with this, which, by the way, is another really confusing thing in nursing school, because these can be assessed with multiple choice questions, which makes it really confusing, because these can obviously also be assessed with multiple choice questions. And so if you don't understand the differences from this chart, then you are totally going to be confused, because you're going to be like, they're multiple choice questions. I used to be so good at them. Why are they so hard now? It's because just because they look like multiple choice questions doesn't mean they're written the way that they used to be. But creation and evaluation, they also have to be evaluated using like essay questions, or like a demonstration, one-on-one demonstration situation, the way like your clinical skills checkoff is. And that is not really feasible to do that kind of a testing on a large scale of students, either in your program or for NCLEX. So that's why one of the reasons they stick with analysis and application. And as long as you can think at this level, you are really prepared to think like a safe, effective beginning nurse. So how do you get past this? How do you start becoming good at analysis and application type questions? The answer is you have to change the way you study. And when you change the way you study, you have to still retain some of the study techniques for understanding and remembering. Because remember, there is information you have to memorize, But you also have to advance your study techniques so that you can practice analyzing an application in your study time. So I say this is you are knowing what you need to know, and then you practice how to think about it. You have to do both phases of studying in nursing school to be successful. And I help nursing students do this all the time. I've been a professional nursing tutor for over 15 years. And when I help students transition to this, I do it using the Silver Bullet study system. It's a simple 4-step study system that mimics the way experienced nurses think. Steps 1 and 2 take you through the bottom part of the Bloom's taxonomy pyramid. And then steps 3 and 4 carefully guide your brain through how to practice thinking about it in a way that is not overwhelming and starts getting you more confident in your own brain and your own thought processes a lot faster than you would even think possible. So if you want some more information about that, head on over to my bio link. I have a free 10-minute overview that explains all about it. I also have a self-study course available, or you can join my group tutoring membership to get my personalized help for learning it for yourself, or sign up for a one-on-one tutoring session. I've got options to help you no matter what your needs are. So remember Bloom's taxonomy, you are not stupid. Nursing exams are harder than you're used to. And so now that you know it, your question is, what are you going to do next about it? Are you going to go forth and change your study habits so that you can have a better nursing school experience and learn to think like a nurse? I hope you will, because I know you have it in you. Good luck on your nursing school journey.